Assalamu alaikum. Dr. Khadija Akram from Pediatrics, and today's topic of presentation is autism. Autism is a developmental disorder that appears in the first 3 years of life and affects the brain's normal development of social and communication skills. Basically, there are three major concerns which are characterized by abnormalities of social interaction, communication, and restriction of behavior and interest. Its prevalence is 2 to 6 per thousand individuals, and it is 4 times more prevalent in boys. There is no non-racial, ethnic, or social boundaries. There are three basic etiologies. Some are genetic factors. They are more common in monozygotic twins than dizygotic twins, and siblings of autistic children shows a prevalence of autistic disorders of 2%. There are some biochemical factors. 1/3 of autistic children have elevated plasma serotonin, and major is parenting influence and social environmental factors. Parental rejection, family breakup, family stress, faulty communication patterns, all are contributing factors to autism. These are clinical features. Basically, these children have issues with communication. They does not respond to their name. Hysteriosis, they laugh, lot of laugh, and aversion to touching, sensitive to noise. They walk on tiptoe. They ignore the dangers, avoiding eye contact, preferring to play alone, and delayed speech development. So first area of discussion is deficit in social interaction. These children have inability to make warm relationship with people. They do not respond to their parents' affectionate behavior. They smile and look at others less often and respond less to their own name. Tend to do their own things regardless of who is around and what is happening in the environment. There is poor use of social signals and weak integration of social, emotional, and communicative behavior. They have failure to make eye-to-eye contact with people. They have deficit in joint attention, impairment in social imitative play, less likely to make requests or share experience. They have difficulty with imaginative play and with developing symbols into language. They have lack of creativity and fantasy in thought process. Deficits in communications include failure to develop normal speech. Spoken language may be atypical. For example, the use of echolalia, non-speech like vocalization such as grunting. Lack of social usage of whatever language skills are present, and deficit in the understanding and use of gestures. Lack of facial expressions and non-verbal communication. In behavioral abnormalities, they have restrictive, repetitive, and stereotype pattern of behavior. Gets very upset by minor changes in routine. Difficulty in generalizing newly learned skills into new situations. They have very ritualistic behavior like checking and touching. For example, dressing up in the particular way, when the rituals are interrupted, children become anxious or angry. They have repeatedly rocking movement, twirling, head banging, and similar repetitive behavior. Overactive, disruptive behavior, temper tantrums, which may occur for little or no reason. Phobias, eating and sleeping disturbances also present. Just like you see in the picture, they also tend to line up all the objects in one straight line. There are also some cognitive abnormalities, poor at symbolization, understanding abstract ideas, and grasping theoretical concepts. Memory can be excellent. And many autistic children enjoys music particularly. In diagnosing, examination and test include complete developmental and medical history, complete physical examination, including routine development examination, screening test for autism, which include checklist for autism in toddler and autism screening questionnaire. There are audiological evaluation, speech language evaluation for morbid genetic and medical conditions. So treatment goals are improve social functioning and play skills, to improve communication skills, both functional and spontaneous, improve adaptive skills, decrease non-functional or negative behavior, and promote academic functioning and cognition. So mostly that work in autism is behavioral therapies, in which ABA, applied behavior analysis, is the most widely implemented evidence-based result. Other are storyboarding, sensory integration therapy, and relationship development intervention. So we'll discuss applied behavior analysis, which is usually beneficial and most beneficial with young children. So 20 to 40 hours per week session is ideal, and the therapist should need proper training and supervision, and regular team meetings needed to maintain consistency. Other evidence-based therapies include speech therapy, occupational therapy, physical therapy, sensory integration, auditory integration therapy, music therapy, and psychotherapy. Basically, psychotherapy is not effective in infantile autism. Parental counseling and supportive therapy is useful in allaying parental anxiety and guilt. There are some education interventions for autistic children. Classroom curriculum emphasizing attention, imitation, communication, play, social interaction, regulation, and self-advocacy. Individualized program for each child, a high staff to student ratio, basically 1-to-1 ratio is most beneficial. A highly supportive teaching environment, teachers with special expertise in working with children with autism, close monitoring and modification as the child's need changes. There are some recommended activities for the autistic children. Any activity that require vigorous activity to improve their overall fitness. For example, walking, hiking, swimming, they are most beneficial. And also all the activities that require the uses of their senses. So the prognosis because autism, the symptoms range from mild to severe. So prognosis depend upon the degree of expression of autism spectrum disorder and degree of developmental delay. Early intervention and behavior therapies can improve their mode of communication and socialization to live with productive independent lifestyle in society. They may demonstrate some aspect of impairment of their senses throughout the life. And children with ASD who have lower Mayat intelligence, for example, whose IQ scores below 50, are likely to need more intensive sport as adults. And in some cases, in severe autism spectrum disorder, there are chances of developing epilepsy. There are some positive autistic traits. All the autistic children have analytic mind. They are hyper focused, visual thinker, communicative, creativity. They have heightened senses. They are honest and loyal and hyper focused. Thank you so much. Any question you want to ask? Thank you so much.